Most seniors over 60 who are dealing with progressive leg weakness assume it is simply aging. Their muscles are getting weaker, their nerves are losing function, their legs are becoming unreliable, and they accept it. But what if I told you that two of the most commonly taken vitamins in America, vitamins that are in almost every senior supplement stack, are actually making that leg weakness worse? Not helping, making it worse. Today I am proving that to you with the research, and I am telling you exactly which two vitamins they are. I am Dr. Michael Kent. I have been practicing internal medicine for over 22 years. Subscribe right now and drop a comment below with your city and your age and tell me which leg symptom is affecting your daily life the most right now. Weakness, heaviness, cramping, or poor balance. I read every single comment and your answer helps me create content that directly serves you. Now let us get into it, because what I am about to share may completely change how you think about your supplement routine. Before I reveal the two vitamins, I need to explain something fundamental about how your leg muscles actually work, because this understanding is what makes everything I share today make immediate and complete sense. Your leg muscles are among the most metabolically demanding tissues in your entire body. The quadriceps, hamstrings, gluteal muscles, and calf muscles that power every step you take, every stair you climb, and every time you rise from a chair, these muscles require a precise balance of mineral cofactors to function properly. Specifically, they require magnesium to regulate muscle fiber relaxation and prevent cramping. They require potassium to maintain the electrochemical gradient across muscle cell membranes that allows muscle fibers to contract with full force. They require calcium in precisely the right ratio to both magnesium and potassium to trigger muscle contractions without causing sustained spasm. And they require adequate B vitamin cofactors, particularly B1, B6, and B12, to power the mitochondrial energy production that fuels muscle contraction. When these mineral and vitamin cofactors are in balance, your leg muscles function powerfully and efficiently. When any one of them is depleted or thrown out of ratio with the others, your legs begin to weaken, cramp, fatigue quickly, and lose the reliable strength that allows you to move through your day with confidence. Now, here is the critical problem. Two specific vitamins, when taken at the doses most commonly recommended for seniors and most commonly present in senior multivitamins, directly disrupt this mineral balance. They compete with the minerals your legs need most. They block absorption. They accelerate excretion. And they create a hidden mineral deficiency that progressively weakens your legs over months and years, while you take them faithfully every single morning believing you are helping yourself. The first vitamin is high-dose vitamin D3, specifically vitamin D3 taken without its essential cofactors at doses above 2000 IU daily without concurrent magnesium supplementation. Now, before you stop reading, I want to be very clear. Vitamin D3 is essential. It is genuinely important for bone health, immune function, and muscle function. I am not telling you to stop taking it. I am telling you something much more specific and much more actionable. That vitamin D3 at high doses without adequate magnesium creates a magnesium deficiency in your leg muscles that directly causes the weakness, cramping, and poor balance that most seniors attribute to aging. Here is the mechanism. Vitamin D3 metabolism, the process by which your body converts the vitamin D3 you take into its active hormonal form, calcitriol, requires magnesium as an essential cofactor at multiple steps in the conversion pathway. Every time you take a dose of vitamin D3, your body draws on its magnesium stores to process it. The higher the dose of D3 you take, the more magnesium gets consumed in this processing. Most seniors take between 2,000 and 5,000 IU of vitamin D3 daily, and most seniors are already magnesium deficient. As I have discussed in previous episodes, 70% of adults over 60 have suboptimal magnesium levels before they even begin taking vitamin D3. When you add high-dose D3 to an already magnesium-deficient body, you create what researchers call a functional magnesium deficiency, meaning the magnesium levels that were already marginal become critically inadequate as D3 processing consumes the remaining reserves. A study published in the journal Magnesium Research found that vitamin D3 supplementation at doses of 2000 IU or above consistently reduced serum magnesium levels in adults who were not simultaneously supplementing with magnesium, with the most dramatic depletion occurring in adults who were already in the lower range of normal magnesium status before beginning D3 supplementation. And magnesium deficiency in leg muscles produces a very specific and very recognizable set of symptoms. Leg muscle weakness, because magnesium is required for the ATP energy production that powers muscle contractions. Leg cramping, particularly at night, because magnesium is required to regulate calcium-driven muscle contractions and prevent sustained involuntary spasm. Poor balance and coordination, because magnesium is required for proper nerve signal transmission from the brain and spinal cord to the leg muscles. And rapid fatigue on exertion, because magnesium-depleted mitochondria cannot produce cellular energy efficiently. These are precisely the symptoms that most seniors experience and attribute to aging. In many cases, they are not aging at all. They are the predictable, correctable consequence of high-dose vitamin D3 consumption without concurrent magnesium replacement. The fix is straightforward. If you are taking 2,000 IU or more of vitamin D3 daily, you must take magnesium glycinate, 300 to 400 milligrams, alongside it every single day, not occasionally, every day. The magnesium must replace what the D3 processing consumes. When this balance is restored, leg muscle strength, cramping frequency, and balance scores improve, often within 2 to 4 weeks. The second vitamin is high-dose supplemental calcium, specifically calcium carbonate or calcium citrate supplements taken at doses of 500 milligrams or above daily without adequate magnesium and vitamin K2 balancing. Calcium supplements are among the most widely recommended supplements for seniors, particularly for women concerned about osteoporosis. And calcium is genuinely important for bone health. But the way most seniors take calcium, in high doses, in poorly absorbed forms, without the cofactors that direct calcium to the right places, creates a problem for leg muscle function that almost nobody discusses. Here is what happens. When you take high-dose calcium supplements, the ratio of calcium to magnesium in your muscle cells shifts dramatically toward calcium excess. And calcium excess in muscle cells produces muscle hyperexcitability, meaning the muscle becomes too easily triggered, too prone to sustained contraction, and unable to fully relax between contractions. The result is muscles that feel constantly tight and heavy, that fatigue quickly because they cannot complete the full relaxation phase of the contraction-relaxation cycle, and that cramp easily because the calcium-driven contraction mechanism is chronically overstimulated. A study published in the American Journal of Clinical Nutrition found that high-dose calcium supplementation above 500 milligrams daily without concurrent magnesium supplementation significantly increased the calcium to magnesium ratio in muscle tissue and was associated with increased rates of muscle cramping, muscle weakness scores, and self-reported leg fatigue in adults over 60. Additionally, and this is critically important, high-dose calcium supplementation without vitamin K2 causes calcium to deposit in soft tissues, including arterial walls and muscle tissue itself, rather than being directed into bone where it belongs. Calcium deposits in leg muscle tissue, called myositis ossificans in extreme cases but occurring at subclinical levels in many seniors, directly impair muscle fiber flexibility and contractile efficiency. The muscle becomes literally stiffer and less functional at the tissue level. The fix for calcium is to reduce your calcium supplement dose to no more than 500 milligrams daily. Always take it with 100 to 200 micrograms of vitamin K2 MK7 to ensure calcium is directed to bone rather than soft tissue, and always take it with 300 to 400 milligrams of magnesium glycinate to restore the calcium-magnesium balance in muscle cells. Now let me address the foods that compound both of these problems significantly. The first category of foods to avoid or significantly reduce are high-phosphate processed foods, including processed meats like deli turkey, ham and hot dogs, canned soups, processed cheese products, and packaged snack foods. These foods contain phosphate additives that bind magnesium in the gut and prevent its absorption. Consuming high-phosphate processed foods while taking high-dose vitamin D3 creates a dual magnesium depletion. D3 consuming magnesium and processing, while phosphates prevent dietary magnesium from being absorbed, that can reduce effective magnesium levels to critically low thresholds extremely rapidly. The second category is high oxalate foods consumed in excess, including raw spinach, raw beet greens, almonds in very large quantities, and certain nuts and seeds. Oxalates bind calcium and magnesium in the gut, forming insoluble compounds that cannot be absorbed. For seniors taking calcium and magnesium supplements, or trying to maintain adequate levels through diet, consuming very high amounts of raw high oxalate foods can significantly impair mineral absorption and compound the deficiencies created by unbalanced vitamin supplementation. The third category is high sodium processed foods. Sodium competes with potassium for absorption and accelerates urinary potassium excretion. Since potassium is as critical as magnesium for leg muscle function, and since most seniors are already borderline potassium deficient, regular consumption of high-sodium processed foods creates a potassium deficiency that compounds the magnesium deficiency created by unbalanced D3 and calcium supplementation. The combination of all three mineral deficiencies simultaneously, magnesium, potassium, and calcium imbalance, is the nutritional foundation of the leg weakness epidemic in seniors over 60. Now let me tell you about Linda. Linda was 68 years old when she first came to see me. She was a retired accountant, a woman who had been meticulous about her health throughout her life, who was deeply distressed by the progressive weakness in her legs over the previous 2 years. She had gone from hiking 5 miles on weekends to struggling to walk 1 mile without her legs feeling completely drained and unreliable. She had fallen twice in the past year, once on stairs and once simply getting up from a chair. Her primary care physician had attributed the weakness to sarcopenia and referred her to physical therapy. When I sat with her and went through her supplement routine in detail, the picture became immediately clear. She was taking 5,000 IU of vitamin D3 daily, recommended by her previous doctor for a deficiency that had since corrected. She was taking 1,000 milligrams of calcium carbonate daily, unrecommended for bone protection. She was taking no magnesium. She was taking no vitamin K2, and her diet included daily consumption of deli turkey sandwiches, canned soup, and processed cheese, all high-phosphate foods that were actively blocking whatever dietary magnesium she was consuming. She had been unknowingly creating a perfect storm of magnesium depletion, high-dose D3 consuming it, high-dose calcium competing with it, and high-phosphate foods preventing its absorption for over 18 months. I made 4 changes, reduced her vitamin D3 from 5,000 IU to 2,000 IU since her levels were now optimal, added magnesium glycinate 400 milligrams daily, reduced her calcium supplement from 1,000 milligrams to 400 milligrams and added 180 micrograms of vitamin K2 MK7 alongside it, and advised her to eliminate the high-phosphate processed foods from her daily diet. At her 6-week follow-up, Linda walked into my office differently than she had at our first appointment, more upright, more confident in her stride. She told me her legs felt like they had woken up. Her most recent physical therapy session had shown a 28% improvement in her leg strength test scores compared to her baseline, a rate of improvement her physical therapist described as unusually rapid. At her 3-month follow-up, she had resumed her weekend walks, not yet 5 miles, but 2 miles consistently without the leg drainage and unreliability that had forced her to stop. She had not fallen since making these changes. And she told me something that I want every senior watching this video to hear. She said, "Dr. Kent, I spent 18 months taking vitamins faithfully every single morning believing I was taking care of myself. Nobody told me those vitamins were making my legs weaker. Nobody told me I needed magnesium alongside them. I lost 18 months of my mobility to a problem that had a simple correction." That story is why I made this video, because Linda is not unique. She represents millions of seniors who are taking the wrong combination of vitamins at the wrong doses, faithfully, conscientiously, every single day, and experiencing the progressive leg weakness that results without ever understanding why. Here is your complete correction protocol starting today. If you are taking more than 2,000 IU of vitamin D3 daily, add 300 to 400 milligrams of magnesium glycinate immediately. Take them together every day without exception. If you are taking more than 500 milligrams of calcium daily, reduce to 400 to 500 milligrams, add 180 micrograms of vitamin K2 MK7, and add 300 to 400 milligrams of magnesium glycinate if you have not already. Eliminate or dramatically reduce high-phosphate processed meats, canned soups, and processed cheese from your daily diet. Replace them with whole food protein sources, eggs, wild-caught fish, legumes, and fresh poultry that do not carry the phosphate additive burden. Speak to your doctor about getting your serum magnesium level tested, specifically requesting a RBC magnesium test, which is more accurate than standard serum magnesium for assessing intracellular muscle magnesium status. Give this correction a minimum of 8 weeks before assessing leg strength results. Magnesium restoration in muscle tissue is a gradual process, but the improvements in leg cramping, leg fatigue, and balance that most patients experience begin within 2 to 3 weeks of consistent correction. Drop a comment below right now with your city and your age and tell me which vitamins you are currently taking every day. I want to know what your supplement routine looks like, and I read every single comment on this channel. Tomorrow, I am revealing the one morning movement, taking less than 3 minutes, that directly activates leg muscle strength, improves balance, and stimulates the nerve connections between your spine and your legs that progressive weakness has been slowly degrading. Subscribe right now and turn on notifications because that video goes live tomorrow morning, and combined with today's supplement correction, it creates a complete leg strengthening protocol that costs almost nothing and starts working immediately. I am Dr. Michael Kent. Share this video right now with every senior you know who is watching their legs get weaker and assuming there is nothing they can do about it. It costs nothing to share and it could give someone their mobility back. Like this video, subscribe to this channel, and I will see you tomorrow. This video is for educational and informational purposes only. The content presented by Dr. Michael Kent does not constitute medical advice, diagnosis, or treatment of any kind. Always consult your qualified healthcare provider before making any changes to your supplement routine or diet, especially if you have existing health conditions or are on prescribed medication. Do not stop or reduce any prescribed medication or supplement without first speaking to your doctor. Individual health circumstances vary and results may not be typical for all individuals. Dr. Michael Kent is a fictional educational persona created for informational and educational purposes. Patient stories, including Linda, are illustrative examples based on common clinical presentations and are not representations of specific real individuals. All research studies referenced in this video are based on peer-reviewed, published scientific literature. Always verify health information with your own qualified medical professional before making any health decisions.